Allah, the most beneficent, the most merciful. Assalamu alaikum. Welcome to the lecture of General Science. We were on the topic of man and health. Today we'll be studying about man and health. In the last lecture, we covered the topic of aging and decaying of body, exercise and healthy living, hygienic conditions, fresh air, water and food, garbage and wastes, regular exercise, rest and sleep, regular prayer. Today we'll be discussing the topics of first aid, which is very necessary for our healthy living. Accidents. What is the first aid in accidents? Snake bite, dog bite, heart attack. How do we deal with it? What is first aid? Basically, first aid is the help given at the time of accident till the patient reaches the hospital to save their life. So basically, first aid is the help that we provide to the patient. In accidents, basically we work on the principle of ABC. What is ABC? Airway, breathing, and circulation. Restoration of airway, restoration of breathing, and restoration of circulation. So firstly we check that if the air passage is blocking, we should position the patient in a way that their airway, their breathing problem is normalized and the circulation is normal. If there is bleeding, then we should block the bleeding. And if a person isn't breathing normally after the incident, call on the ambulance and start CPR straight away. And if you do not know how to CPR, then avoid giving CPR. Just give CPR with hands. Use hands only if CPR. Only CPR if you aren't trained to perform rescue breaths. Keep them under observation to ensure they continue to breathe normally and don't obstruct their airway. Means do not block their airway. Snake bite. What do we do in a snake bite? Basically, coming on to this topic, what is a snake bite? When the snake bites, it is not at all fatal. Basically, it depends if the venom on the venom. The venom released during the bite can cause considerable pain and illness or death. The treatment would be that identify the snake if possible, or kill the snake and carry it to the medical staff. This will enable them to prepare the appropriate anti-venom. Basically, you need to recognize the snake. You need to know that the description of the snake to tell the doctor that this was the type of snake. And the description matters a lot. If you have seen the snake, you just remember how it looks like. So then only the doctor will be able to prepare the anti-venom in a better way. Wash out the wound with soap and water and cover it with a clean cloth and dress the wound properly. Place a broad bandage or cloth strip just above the site of the wound and fix it firmly but not too tight. Basically, you just have to, in this diagram, they have tightly tied up the wound, and it is because the bite of the snake is in the arm. So if it is in the arm, you just tie up the arm so the venom does not spread into the body, all of the body. It just stays in the hand, so it is easy for the doctor to clean the hand and remove the venom from the body and help it removing it through antivenom. So immobilize the limb or the place that is under this bite or condition. Basically, you need to immobilize means you do not need it to move. So just make sure that the patient moves the least, and arrange for the person immediate removal to the nearest hospital, and do not delay. Then, coming on to the dog's bite or any animal's bite, you just need to be seriously focusing on the steps that you need to follow under these conditions. Firstly, if your skin wasn't broken, means it's just a rash, just wash through that area with warm water and soap and apply the antibacterial lotion to the area as a precaution. If the skin was broken, then wash the area with the warm soap and water and gently press on the wound to promote a small amount of bleeding. This will help the germs to flush out, and this will help your body to heal properly. Once the germs are flushed out, if the bite is already bleeding, apply a clean cloth to the wound and gently press down to stop the flow. Follow up an application of antibacterial lotion, then allow the lotion to spread on that, and bandage on the cover the wound properly with the bandage, and then control the serious bleeding, and you have to cover the wound and observe carefully if the patient does not go under shock, and you also have to let them know that this isn't a serious matter, so they do not undergo a shock. Arrange proper intermediate transfer to the hospital. Okay, in case of heart attack, a heart attack is a condition in which a person can even lead to sudden death. So you need to make sure that the person is having the correct symptoms. Firstly, if they are holding their chest from or the left hand, they might be having a pain or heart attack, minor heart attack or major heart attack. So you need to carefully observe the symptoms. If you think a person is having or has had a heart attack, sit them down, make them as comfortable as possible, and call an ambulance. Symptoms include chest pain. The pain is usually located at the center of or left of the chest and can feel as a sensation of pressure, tightness, or squeezing. Pain in the other parts of the body, it can feel as the pain is traveling from the chest to both of the arms or one arm, left arm, or into the jaw or neck or back or abdomen tummy. Sit the person down and make them comfortable unless the help arrives. That's it for today. Now we'll be discussing other topics in the next lecture. Thank you.